Good morning, I'm Doug Smith, and this is a special edition of Portsmouth This Week. We're doing this on the 14th of May, 2013, and our special guest today are Ray Davis, the coordinator of the Portsmouth Prevention Coalition. Welcome, Ray.
Thank you.
And also Dave Croston, the chairman of our school committee. Welcome back, Dave. We just had you on a couple days ago, it seems like. Ray, you gave a really interesting presentation to the town council last night about the results of a study that you did here in Portsmouth. Before we get to the details of that, I just wonder if you could tell us a little bit about your own background, how you got into this kind of field.
My background is I was a social worker that investigated child abuse and child neglect in Akron, Ohio for about 7 years, and then I moved to Rhode Island about 29 years ago. Worked for DCYF in that capacity as well, but decided that as a result of what I saw in the child welfare system due to substance abuse issues, I wanted to move to a different field, and I was the prevention coordinator for Kodak Behavioral Health Care here in Newport for about 7 years, and went back to school to become certified as a prevention specialist and have all 3 levels of certification, and then I'm a certified prevention specialist supervisor. I worked for Kodak, as I said, for 7 years, was the prevention coordinator, director for Caritas, which was an adolescent treatment center for a while, and then I've been doing prevention services. I was a grant manager for an underage drinking grant for the city of Newport for 3 years, and I've been a member of the Portsmouth Coalition as a citizen. I live in Portsmouth for at least the last 10 years and became the coordinator there about 1.5 years ago. That's a brief background.
Yeah, well, it sounds pretty impressive to me. Your organization, the Prevention Coalition, I assume that's a nonprofit, and how is it funded?
It is a nonprofit. It's through the Rhode Island legislature created prevention coalitions for all the towns in the state of Rhode Island, and it is funded minimally, very minimally, through the state, as well as the town of Portsmouth supports it to a small degree as well. We've had other grants. The school committee helped us with this study financially, and we can apply for other grants, state and federal grants as well, that deal with substance abuse prevention.
I hope you also take donations from outside citizens, because I think when people in Portsmouth see and understand the results of this study, I think hopefully they'll take this stuff a lot more seriously. And why don't we get into that? What were the goals of this study, and how was it conducted?
The goals of the study were the format that we used is a format that is suggested by the federal government for any type of grants, and it's the same format I used as the underage drinking grant in Newport, because very basically just say no does not work. A single program in a school for 9th graders is good for those members in that classroom, but that doesn't really provide enough change. The way to do this is, and I always preface this by, look at what's happened with smoking in this country. You know, in our lifetimes, it's changed so much. It's the largest public health issue that has changed, to my knowledge. The way that happened was by medical profession being involved, advertising, policy changes, law changes, little kids coming home to their parents saying, you know, I don't want you to smoke because I want you to be around. Those changes made a huge difference. And part of the way to get to that, it's like a medical issue. You can't find a fix for a problem until you know what the problem is. So that was the purpose of having this needs assessment, so we could find out what are the issues in Portsmouth that are affecting our students, the youth. What are they? What are the causes? What are the beliefs behind that? What are the attitudes? And from that, we'll have material for us to direct our actions as a community to try and do some preventative things to lessen what's going on.
Can you talk a little bit about this survey itself, and how it was conducted, how valid you think the results are, and just things like that?
The survey was conducted by John Matson from John Matson Consulting, and John is well known in the state. He's done this survey for every single school system in Newport County, as well as other organizations and other schools throughout the state. This survey that we used with the students has to be approved by the Rhode Island Department of Education, which it was, and the Portsmouth School Department. This is a format that's been used and is requested by the federal government if you choose to apply for certain grants for them, and the state of Rhode Island wish that all of us would do it this way as well. And the study itself was made up of four different components. One is just taking a look at the data that we have around arrest records, juvenile hearing board records, what our town looks like from an observer who has no idea what Portsmouth looks like. And then we did a survey of the students in the 7th, 8th, 9th, 10th, 11th, and 12th grades. There were 1,203 surveys returned. That's phenomenal as far as the return is concerned. Mr. Matson said he has never seen that kind of response from any other school he's done this in.
What was the total number sent out? Or
I don't know what the total number was, but it's around, we had around a 90 to 95% return rate.
okay, that's very high.
It's very high.
Yeah.
There were and there's a process that I can't explain because he was the evaluator to eliminate some things that you know that are false answers or someone's just being funny on it. Those aren't included in it. So there was around 35 of those that were rejected. So we had a very good return. And in the report that we have, it shows the breakdown, very even with male, female, and I want to thank the Portsmouth School Department for assisting to make sure that we got that kind of a response, because again, it goes to the validity of what we found. The surveys were sent out, collected, gone through. In addition to that, we did 4 focus groups. We did a group with 7th and 8th graders, 9th and 10th, 11th and 12th, and a group of parents as well. And these were made up of students from various backgrounds as well as parents. And they gave us a great amount of additional feelings, their thoughts on things, their attitudes, and that's included in this report, and it's just as important as the statistical data that we have as well. And then the final piece of that was we interviewed 5 key informants, and what key informants are members of the community who have a very professional and personal understanding of the youth issues that are going on in the town, that were able to give us incredible information about their observations on this. Everyone involved in the study was guaranteed anonymity. There was absolutely no identifying information on the student surveys as well. The only thing that we did was we broke it down by zip codes, because our friends in Little Compton, who do have students at Portsmouth High School, contributed $500 towards us completing this study.
So it gave them a sense, too, of their own student activity.
Right, and we shared that information with them.
Well, I think so we've got a study. It was put together, and it's the kind of study that's been used in other cities and towns around the country, really.
Yes.
The results have very high validity, and generally what 95% valid means that you'd have a 95% assuredness that if everybody took the survey, you'd still come up with the same answer. So I think that's very high. So I guess let me get into the next part, which what were the results, and how do you break this down for us?
Well, I think one of the interesting things is when you talk about perceptions, 90%, well, let me back up. We asked the kids, how many of your peers do you think were honest in answering these questions? And they said they thought that maybe 12% of the kids were honest in it. And that's usually the first thing I hear from someone is, well, you know, they're not going to tell the truth. Well, we asked that question in the survey, and when we did, 90% of the kids said that they told the truth. And I was involved in all the focus groups, and those kids, my hat's off to them, because they were very honest with us and very truthful. And I thank them for the information they gave us. Sometimes it's a little hard to take.
It's tough in a peer group, too.
It is, but those kids were great, and I thank them for that. So the validity, again, comes from the number of surveys that we got back. It's astounding. So which makes our findings that much more valid and gives them a little bit more, to it, as well as the comments that we heard from the students and the parents as well.
Well, let's get into the nuts and bolts of this, I guess, the hard part. How did we come out, and what does it look like?
You know, I want to say this up front, is that, again, I want to thank the Portsmouth School Committee for coming to our rescue, because we did not get a grant that we wanted to be able to finish this, and they came forward to enable us to do this, and they've been very helpful in making sure that we could get this out to the public. So thank you, Dave. Losing my voice here. What we found is, the first question people ask is, well, how are we compared to everybody else? And there was a young man who had an article, who wrote a little editorial in the Newport Daily News this past weekend. And my hat's off to that young man, because he hit it right on the head. And are we worse than some schools? Yes. Are we not as bad as some schools? Yes. Do we have a problem in Portsmouth? We have a problem in Portsmouth. And that's where we're coming from this. And that's what the statistics show us as well. We're very close to what's going on in the country, what's going on in Newport County, in the state.
It's just very interesting that that's one of the questions that immediately pops into your mind, is how well do we do compared to everybody else? Or, you know, and yet it's really almost irrelevant, because this is a problem right here in our town that we've identified, and we've got good data to back it up.
The perspective, though, of the school committee has always been, and there was no one event that basically had us say that we need to support this study. When this committee actually sat for the first time, we, through some mutual relationships, found each other and found this mutual need to finish this study and then focus our attention on what are the true concerns in the school. Now, we spend a fortune trying to get our grades up 1 or 2 points in a let's say the kneecap, which is our high stakes test. The reality is maybe if we focus a little bit more on, you know, the state of some of the students as they come to school, or what they do after. This is all about knowing that we have a problem and saying, look, I don't care what happens in Middletown or in Tiverton. Quite frankly, we need to encourage our students to speak to their peers. We need to have them be the leaders of this change. And the most fascinating thing is, none of these kids, a very low percentage, smoke, and a very high percentage believe that smoking was bad for them. Yet 12th grade males, over 70% of the 12th grade male thought it was okay to actually smoke pot, marijuana, I'm showing my age, on a daily basis. And so that perception has to change. And so, and it's not that we have to do something purely on the school committee side and purely on a policy side. I hope this study wakes up parents. While he's catching his voice, let me just say some of the highlights that stood out for me. In the last 30 days of the study, 49% of 12th graders, both male and female, I mean, there was maybe a 1 or 2 point differential between the male and the female. 49% had used marijuana. Half. I mean, so that's our leaders. That's our sports captains. Those are the people that are basically, we look to every single day as peer models. All right? 65% had used alcohol. So do we have a problem? I mean, I think that's, quite frankly, a shocking number. And then where we see in the demographics, the study actually shows that, all right, we're okay through the 9th grade, but we're obviously not doing enough to educate our children because it's progressively worse in 10th, 11th, 12th.
Yeah.
And you know what? If the males were leading in the 10th grade, I'll tell you the females do a great job of catching up by the 12th grade. So
it levels out. The sexual differences in use of this stuff level out.
And one last thought, and then I'll give it back to the expert. But the reality is the parents think, oh, these drugs are coming in from Tiverton or Fall River, or that, I mean, it was a fascinating statement that the parents felt that it was external to us. And the kids said, no, we can buy it anytime, anywhere, anyhow, and it's available to us here in Portsmouth, grown in Portsmouth.
Yeah.
So we have to...
Kind of a wake-up call here.
This is a shake, yeah.
I should explain to our audience that Ray spoke to the town council for over an hour, I think, last night, gave an excellent presentation in great detail, and I'll tell you at the end of the program how you can access the full report to take a look at this stuff. But that might be one of the reasons you're probably losing your voice a little bit. Yeah. How serious is the alcohol problem? Let's just take them one at a time. Alcohol, marijuana, and then smoking, I guess.
And prescription drugs
were
also part of this. Alcohol is by far the leading substance that is abused by adolescents, by far. And when we dug deeper with that, we found out, that most of the kids are saying that they're getting that alcohol. They're not purchasing it from the package stores. The package stores, I want to commend them for doing a very good job in Portsmouth of not selling to minors. And the kids all verified that as well. They get it from either older friends, older siblings buying it for them, not Roger Williams University students. We didn't get any of that in our survey. Or stealing it from their parents' liquor cabinets. In some rare cases, their parents providing it for them. That's where they seem to be getting the alcohol. And that, as all these substances, they rise in usage by age groups. And the perception, and again, I go back to this measuring perceptions. The kids think that everyone is doing this, when in reality, when we ask them, the numbers are so much lower. The perception is that it's almost normal to be doing this.
Right.
And that's the issue that when we look at how we're going to approach all of this, if we can change perceptions, we'll change behaviors.
And for the parents, I mean, I think they have to know it's a very different alcohol story than when we grew up.
I'm sure.
I mean, I would think high school, fine, it's a beer party, and someone's gotten a case and they're off in the woods, or when someone's parents aren't home, hopefully. But that's not the case. This is vodka, and they're drinking to binge, so that came clearly out in the study that this is not the same alcohol problem that we would think back as parents as to our high school days. And is this a precursor of a larger problem? So,
and I think going along with that is that we also found in our study that oftentimes kids' first introduction to alcohol may also be the first introduction to marijuana as well. There's a lot of crossover that at parties from a friend. And when we talk about alcohol, I want to make sure that we're talking about adolescents using alcohol, which is very different from an adult sitting down and having a couple of drinks. We're talking about binge drinking, as Dave referred to.
What ages are we talking about here, though?
We're talking about,
I'm sure young kids do it, but...
Young kids do, and a disturbing thing about this is that we found that those young kids, and it's a small number, who started alcohol, about 20%, I think, had done this 10 years or younger.
Gee,
10
years.
Yes. The main years seem to be 13, 14, 15. Those through all of the substances that we looked at. And dramatic rises in those years. The difference between when they leave middle school and they leave high school is stunning.
So the numbers really go up when they get into high school and they start going through the grades?
And really the sophomore class. So, and it's not indicative of this sophomore class, it's indicative of the fact that if they're peer groups, and we can see some increases, and maybe it's the female population actually dating older classmates, but you can see the 10th grade really starting to jump from the 9th grade. And what that gives us is hope that when they enter the high school, there's not let's say, a significant problem. There's a problem that has to be addressed. But as they go into 10th, 11th,
So
and
it gives
12th
us an
grade,
idea of perhaps where we could intervene
That's right.
and come up with programs
Absolutely.
to help, and that kind of stuff. Just let's go to high school seniors, for example. What are we talking about for alcohol use, marijuana use, prescription drug use, just generally speaking from the survey results?
The alcohol rates, I'm trying to remember specifically
You
from
got so much data
I
here.
know, but I think it's around, I think it was,
So
I think it was almost like, I don't want to say 70%, but
It was very high, as I recall.
they reported, well, actually this is good, they reported overall use of alcohol at
64,
64%, saying that they had.
65.
So 64% of high school seniors have had alcohol in the last 30 days.
No, they've had alcohol, period. At the
Period.
last 30 days, it's
Well,
almost...
that's 11th and 12th. So
Okay.
if we go back up here, alcohol use in the last 30 days, 65% used. Marijuana use, 49%.
So half
half.
have used marijuana.
And the males and
half
females
of
are
all the kids in high school
right.
have used marijuana in the last
No,
30 days.
half of the senior, this is for seniors.
Excuse me, seniors in
Right.
high school, yeah, right, okay.
And that's why in the study you see this, basically we can actually put on a graph that says, all right, here's the entire picture from 7th through 12th. But it really gives us a false sense of what the use is.
Yeah.
But I mean, we really have to back it down from the 12th grade, the 11th grade. And,
Sure.
you know, that use picture, 49% of seniors using marijuana, 42% of juniors using marijuana in the last 30 days. 65% of seniors using alcohol, 47% using alcohol in the 11th grade. And then that drops to 66% of sophomores using marijuana. I mean, if this is 95% accurate, I think parents should be absolutely shocked at these numbers.
You know, as a parent, I would immediately think, well, that's the other half of those kids. It's not my kids doing this. And I think, you know, this is a parent issue, major parent issue, I think.
Well, it's a community issue.
Right.
It's
Well, it
one
is.
that, yeah.
But this is one where parents have to have some responsibility for their kids, and they have to realize that it's not just everybody else's kid that's doing it. I think the scariest thing, though, Dave, you mentioned it earlier, was the perception that kids have that, as you say, people don't want to smoke because it's bad for them, bad for their health, but 70% think it's okay to do marijuana every day. And you know, we don't have a lot of time left already in this program, and I want to talk about where we're going to go with this. It seems like one of the things would be the education part of it, to show that there are real dangers with using marijuana. You know, people think 70% thinks it's okay. There's something wrong with that perception.
And you know what the most, you know, kind of the happiest thing that came out of this study was that the middle school students were desperate for education. The younger kids
Yes.
in the high school wanted to know more. What are the health risks? What are the health risks to smoke in smoking marijuana? And so that's a good trend. And I think we need a comprehensive response to this. That's not only that is
Absolutely.
not punitive,
Yeah.
but is based on education.
And that might give you a data point to say this is where we need to start the education,
That's right.
at that point where people want it. What were some of the other things that came out of this that might be effective?
Well, I think, again, the other thing is that this is a community issue. It is not just the schools. And part of what we want to do is to have a comprehensive approach to how we're going to do this, involving the schools, the town as far as policies, the coalition, and what we can do to get information out to families and involve the community in this. Church groups, anywhere we can get this information out and have discussions. The most powerful prevention tool ever invented is a parent. For parents just to have discussions with their kids about these issues is extremely important.
And it's not just left with these issues of prevention. I mean, it also addresses some of the things we've talked about with opening our facilities so that youth have a place to go on a Friday or Saturday
Alternatives.
night. I mean, you know, I have a high schooler, And the reality is there's a challenge out there that if they're not participating in these types of events and they're not going to the parties, quote unquote, the reality is that we need alternative activities for them. And that may be an investment in our time and resources to do so. But I think we have those assets. We have to now have the will to use those assets.
Now, the thing is, as we move forward in this, what are the next steps for your coalition, for example? Do you try to bring together maybe some parents, some other people, and come up with an action plan of things we might want to do?
We have parents that are involved in our coalition very much so. I think the next step is for us to sit down with our coalition, with the school department, which we have had discussions, and form, I think, a study made up of, not just a study, a group made up of the community, and put a plan of action out to approach it from that standpoint, with various members of and portions of the community being involved in that.
This is something that I hope everybody in Portsmouth would get behind. And one of the things that you're telling me that I hear out of this is that parents need a lot more education themselves.
Well,
people need information.
And what we need we need to educate our teachers, we need to educate our parents, we need to tell them it's okay to actually question the activities. I mean, we have a long way to go.
Absolutely.
And what we promise all the residents is really that this will be a process where we communicate as a community, that we come up with solutions as a community, and we're excited to be working with the Portsmouth Prevention Coalition on this.
Great. I'm out of time already. I would like to talk to you guys for another couple hours about this. But I would like to invite you back so we can use this forum perhaps to get the word out to parents and the rest of the community about what we can do. And I'd like to thank you, Ray Davis, and also Dave Crossan, for being my special guest here today. Thank you very much, gentlemen.
Thank you, Mr. Smith.
And thank you all. Don't forget, this is Portsmouth's 375th year. Get out there and enjoy our events. Thank you.
"375 years ago, a group of dissenters from the Boston colony landed on the shores of Aquidneck Island. In 1638, they signed a compact to form the town of Portsmouth, Rhode Island. This year, Portsmouth is celebrating this anniversary with a series of events that started with a polar dive into the icy waters of the Sakonnet River on New Year's Day. The list of events has fun in store for the entire family. Town historian Jim Gorman is doing a series of lectures to convey his wealth of knowledge of Portsmouth's history and to instill an interest in our citizens into the rich history of the town. Many other events are being planned, including a celebration weekend from August 29th through September 1st that includes visits of the Lord Mayor of Portsmouth, England, officials from Portsmouth, New Hampshire and Virginia, a grand parade, a polo match between the U.S. and the U.K., and a fun-filled family day at Glen Park. Don't miss any of these great activities and historical places of interest in the town. Information about the celebration and events can be found at the 375th website, www.portsmouthri375.com.